So welcome to today's panel discussion webinar. I'm Mark Graban from KaiNexus. I'm going to be your host and moderator for this session that's titled How Lean and Continuous Improvement Helps You Get More Nimble and Adaptive in a Pandemic and Beyond. Let me a little bit more formally introduce our panelists today. Dr. John Toussaint is an internist. He's a former healthcare CEO, and he's one of the foremost figures in the adoption of organizational excellence principles in healthcare. He founded Catalysis, a nonprofit education institute, in 2008. And Catalysis has a number of networks and initiatives and products, including workshops, books, DVDs, webinars. John has written this is now 4 books. He's written 3 books that all received the prestigious Shingo Research and Publication Award. He wrote On the Mend, Potent Medicine, and Management on the Mend. And I'm going to hold up his most recent book here called Becoming the Change. And so this book is new, and that's why it's not in that 4th Shingo list. But we shall wait and see, and I encourage people to go check that out. So John, thank you for being here today.
Thanks.
And we're also joined by Skip Steward, who currently serves as Vice President and Chief Improvement Officer for Baptist Memorial Healthcare, which is headquartered in Memphis, Tennessee. And Skip develops, directs, and implements performance improvement activities, identifying inefficiencies. He also implements strategies to improve quality, service, and finances, and fosters a culture of continuous improvement and excellence. So Skip, thank you for being here.
Thank you.
And we're also joined by Dr. Greg Jacobson. He is our CEO and a co-founder of KaiNexus. Greg graduated from Washington University with a BS in biology. He attended Baylor College of Medicine and completed his residency in emergency medicine at Vanderbilt University Medical Center, where he stayed on as faculty, and that's how he learned about Kaizen and continuous improvement. Greg is also still an active practicing ER physician who's fanatical about the single biggest barrier holding companies back from greatness, their lack of continuous improvement work. And so that took him down the path of developing and growing and leading KaiNexus. So Greg, thank you also for being here today. Oh, you're muted, Greg.
Oh, thank you. It's good to be here.
Sure thing. So to get things started, as the topic of the webinar is today, talking about lean and continuous improvement, being more nimble, being more adaptive, not just during pandemic times, but really any other time. So first question to throw out here is, I think kind of starting with, the proposition, I think it's maybe a fair generalization that people often equate lean with standardization, and they might fear then that we get inflexibility as a result of focusing on standard work. So maybe John, to start with you, and in your experience and what you see in other organizations, how does lean actually help create agility and adaptiveness?
Well, as we all know that have been in this world for a long time, we can't improve anything until we have created a standard or standard work. And we see that in clinical medicine all the time, where we use placebo-controlled double-blind studies to determine what the evidence is for doing what we do, whether it's doing surgery or prescribing medication. But when it comes to management, there really are no evidence-based activities, and so we have no standards. And because we have no standards, we can't improve anything. So that's why lean has been so critical, I think, for so many organizations really around the world. I just was on the phone with one of the CEOs in Johannesburg, South Africa, saying if she hadn't had a lean management system, she probably would not have been able to survive the mess that they've had over there. So I think the point is that when we create the standards, we can then improve those standards. And when we have standards and we have standard work, we can actually spend our time thinking about the more difficult problems. And I think that's what unleashes the creativity is the fact that we're not running around looking for things. We're not in a chaotic mode. We actually have a set of processes that work every single day. And it allows us to really think bigger, I guess, is the way I think of it, is think bigger about, okay, what are the problems that might happen that we need to be thinking about, like pandemic. I mean, I think we could have all been much better prepared if we would have spent more time, utilizing our standard work for management and thinking about, what are the things that can really go wrong and trying to focus on those instead.
Thanks, John. Skip, what are your thoughts about that? Lean and being more adaptive and nimble.
I think to build off what Dr. Toussaint was saying is that I think it unleashes a level of creativity and experimentation. As we have a standard outcome, we then have to come up with a standard method to produce that standard outcome. That normally, whatever we create at first is not going to work. And so we're going to have to experiment our way forward to have that standard method consistently, day in and day out, produce that standard method. And so we unleash experimentation, we unleash creativity. And to do that, there are a lot of parts and pieces that have to come to play. We show respect. We have to do that with humility. And I think it allows us to be able to study and adjust on a daily basis as we're striving to improve patient care.
Thanks, Skip. Greg, what are your thoughts on this topic?
I mean, I think it's an unfortunate association that's been created when people think of lean. Their initial, I guess when people think about lean and they don't know much about lean, their initial conclusion is that lean equals standard work and standard work equals inflexibility. And I would argue that organizations that I've been in that are doing this well are exactly the opposite, right? Organizations that don't subscribe to these practices are often say things like, well, that's just the way we do things here. And there's never a push or a agitation. I know that's a negative word, but I love the word. There's never an agitation coming from leadership that says, hey, constantly think about the work that we're doing and think about how we're going to get better doing it. So in my mind, the flexibility, the creativity that humans have, it flourishes when constraints are put on humans. I think we talked about this a little bit in the preview, if you had an opportunity to listen to that. And without any constraints, it's essentially, you can think of it as art. But imagine an artist that doesn't even have a discipline that, from day to day goes from, watercolors to sculpture to poetry to, the constraint of the discipline is what creates oftentimes the beauty and I think that humans excel ultimately when that constraint is identified. And I'm using the term constraint instead of the term standard work, just to kind of expand the concept outside of kind of business terms and look at it from a design perspective. But that's essentially what we're all doing, whether you're working in a hospital or you're working in a software company. You're designing a workflow, you're designing a process, you're designing a way we all interact, you're designing the next step. And you can't really become creative and figure out how to do it without defining that standard work. And then once you do, and then you take the next step to create a methodology that constantly affords opportunity for people to question what they're doing, for people to engage in improving that system, then all of a sudden you realize that what seemed inflexible is actually, it's highly flexible. That's probably a good place to end. I think we'll probably get into lots more aspects of this topic, seeing as how it is the title of our panel discussion.
Yeah. So one follow-up question, I'll look for volunteers if any or all of you want to touch on this. So you're kind of building on the idea of structure or standards or constraints. What's your experience in terms of the benefits of having a structured approach to improvement? Does that structure help unleash creativity, whether we think of it as small Kaizen or the structure of Toyota Kata or other frameworks?
Well, I think there's some really good examples of how a structured framework has really helped organizations navigate COVID. Mount Sinai, Morningside Hospital, for example, when it was, really in the depths of this crisis, basically they were asking their frontline workers to solve hundreds of different problems each day, and they did. And they came up with fantastic ideas that managers and executives would have never thought of in a million years. They converted in 5 days. They converted 60 rooms to ICU rooms that were outpatient GI rooms. That was all done by the staff, and it was just taking the ideas of those staff and having them run with it, and using PDSA cycles to determine whether or not it was working, and then quickly adjusting. So I think what we need to do is make sure that our management system actually supports this. As Skip says, this unleashing of the creativity, because these folks can be very creative if we give them the structure to allow that to happen. And in most cases, the structure doesn't exist. So we need a management system that actually allows for people to rapidly identify and solve problems at the front line. And that's really what this method does, is allows that that tremendous resource that we all have to actually be utilized at the highest level of the scope of license and of the scope of thinking.
I think another thing, Mark, is that it's really counterintuitive, right? Whether it be the improvement in coaching kata, or whether it be the A3 format, the structure actually opens up the creativity. It expands the creativity, and it's very counterintuitive at first, but once you're into it, you actually see that structure becomes a friend. And what's interesting is we don't tend to question a lot of structure in other aspects of life. Great athletes don't come to practice and just swing the bat any way they want and practice any way they want, and hopefully it all works out in the game day. They have a really structured way of practicing, and you'll see in game day where that athlete's creativity and true athletics will expand. So I would argue that it's counterintuitive sometimes.
And Greg, maybe just to frame a more specific question for you, thinking back when you first got introduced to Masaki Imai's work and books around Kaizen, what were your thoughts as a resident about having structure for improvement? What do you remember then, or what have you learned over time?
Yeah, I mean, I think I break all improvement work just into two simple categories. So to me, there's bottom-up improvement work and there's top-down improvement work. And I think that they both have different flavors to them. So the bottom-up improvement work is improvement work that's initiated by someone on the front line. Oftentimes in Lean, we refer to them as just do it's, or OIs, or OFIs, and or maybe an identification of a defect, an incident. Top-down improvement work is maybe initiated from someone from the front line, but really goes through and gets up into a higher level in the organization because perhaps it's a bigger, complex problem. And these might take the form of projects and larger PDSAs or larger A3s. There's typically going to be multiple parts to them, and there's going to be multidisciplinary teams to them. So the bottom-up work, I think, is a very good example of if you have too much rigidity and too many steps and too many barriers to engage in that, you're going to limit participation. And so when you're talking about a kind of a frontline idea system or Kaizen minded, I cringe at the word idea, even though I just said it, just an easy 4-letter word. Opportunity for improvement system. And then, for example, you have 15 questions someone needs to ask in order to submit that into the system. That's going to significantly decrease participation for, since we're all healthcare, an ER doc who has a bunch of patients to see for them to, pull out their phone and then start answering all these questions, and it takes 5.5 minutes to submit something, the participation is going to be super low. If you take that same idea and flip it on its head and say, oh, well, you can do a multidisciplinary 6-month project with 25 different resources and, a $10,000 budget, and you don't have to answer 15 different questions, then you're probably going to be doing a lot of bad projects. Mm-hmm. And so I think we certainly both are going to need some a thought process, but the level of whether it's low cost, low risk, and now with the pandemic, how quickly is it needed? Because converting 50 rooms into ICU bed is certainly not low cost or low risk, but the speed at which that has to happen, if it would have happened in a normal, longer cycle, would have been irrelevant. I mean, it has to happen today. And so it's a good example of maybe a bottom up kind of scenario, or at least an implementation working that way. I will say one last thing, just to touch on the prior question, because I know you reframed it in more specificity, but a lot of folks that are healthcare, and I don't know what the mix is here, will recognize the method in which physicians or practitioners, all practitioners, will kind of go through their process. What's your chief complaint? What's your history of present illness? The review of systems, then your past medical history, your past surgical history, your social history, your physical exam, starting with your vital signs, then going through the physical exam, head to toe, then coming up with your differential diagnosis, and then coming up with your plan to test that. There's a very specific reason why it is framed in that order, and why, like Skip said, you don't just say, oh, well, go figure out what's going on in room 4, and you don't learn that process. So a lot of times a process has the order in which thoughts need to occur for you to come up with the best answer that you could come up with at the time. And so certainly different improvement activities are going to have different levels of rigidity, and they are going to be very important to follow in order to get the highest quality improvement work that is going to be able to come out of that individual person or that group of people.
Yeah. Okay, and a reminder for the audience, please do submit questions in the Q&A box. And if you pull up that Q&A box, if there are questions that you want to upvote, click the thumbs up arrow. That'll help accomplish that and bubble up questions that have the most interest. But before we do that, maybe kind of shift from kind of general thoughts on lean and adaptiveness, and maybe talk about here during pandemic times. So Skip, maybe we'll start with you and what Baptist has done during the pandemic to use lean and related strategies to be more nimble and to help battle these challenges.
What we have seen during the pandemic, our Baptist management system, what some people would call lean, or is based on 11 guiding principles, and we believe that behaviors come out of those principles, and it's connected to our overall work. And we've seen those principles live out, and we've seen the Baptist management system manifest itself. So we have spent many years investing into a scientific thinking process that we call the improvement kata, coaching kata, other things like TWI and so forth. And the thing that shocked me a little bit when the pandemic hit was how many phone calls from mid-March through mid-July I received, or text or emails, that said, thank you so much for the Baptist management system. I wouldn't have wanted to not have it. And so I dug into that a little bit. I wanted to understand specifically, what do you mean? And what always came back was two things. One was, yes, thank you for our scientific way of thinking with kata. It's very normal and natural for people to say, let's go run an experiment, or let's experiment with that. So that became more of their natural versus what tends to be most humans' natural, is to jump to conclusions. But the thing that probably surprised me the most that was the most encouraging was there was this overwhelming response of people saying, thank you for TWI job relations, which for those that understand what training within industry is, there's 3 legs to the stool: job instructions, job relations, and job methods. And relations is how do we deal with people? How do we get people to follow our leadership? And when that doesn't occur and there might be a people problem, how do we deal with that in a structured, respectful way versus responding emotionally? And we've seen a tremendous amount of feedback from that. And the other thing we've seen during this pandemic was we've seen our leaders live out some of these principles of humility and of trust and empathy. We've seen our CEO and my boss, the COO, doing rounds with nurses all day long, dressed out in all of the medical gear so that they could walk a day in their shoes. We saw things like no layoffs. We raised a tremendous amount of funds to provide people that needed economic and financial help. The thing that also surprised us was that our employee engagement scores went through the roof. When everyone else's were going down, Press Ganey told us, ours, they couldn't explain why they were going so high. And so I could keep on going, but I think a lot of that is based on a principle-minded management system. And so it's given people the permission to experiment. And I remember like one of the very first days, and I'll stop with this story, I had a physician call me on a Saturday and said, Skip, I think that the test line where they're doing the nasal test for the COVID, I'm not so sure it's being done correct. And I said, well, okay, so tell me more. And we talked about that. And she really wasn't calling for my help. I think she was just calling to be a sound. She said, I'm going to go create a job instruction breakdown on exactly how that's done. And but since it's just an experiment, I'll go road test it and I'll call you back and tell you how it went. And by Monday, that was a Saturday, by Monday, that job instruction breakdown had went through many iterations, and then it was being spread to our 22 hospitals within a couple of days of it being created. So that's just an example, I think, of what we've seen so far.
Thanks, Skip. John, you've mentioned a couple of organizations already. You talk to and work with a lot of organizations. What are some other examples that you would want to share about some of the good work that's been done during the pandemic?
I mean, there's so many. It's hard to choose. The Torrance Memorial folks out in California, instead of furloughing people, they basically took the 500 idle staff and they had them build PPE. They built shields, they built, wipes, they did all kinds of things like that. In addition, they were redeployed to, the entrances to take temperatures and do things. So UMass Memorial, same thing. They said, we're not going to lay anybody off. We're not going to furlough anybody. We're going to redeploy to areas that we need. I mean, this is the ultimate respect. And, I think there's two things that have emerged from these types of places. One is that respect for people, an important principle. When you really respect people, you don't lay them off. When you really respect people, you make sure that they're safe, that they have what they need to do their work. You create that environment. And organizations that have really been focused on the method of organizational excellence with principles and behaviors and systems have done some just amazing things. I'll mention one more. Christie Clinic, they did early on some radical changes. Instead of mixing patients together that might be infected versus ones that weren't, because the uninfected ones didn't want to come to the clinic. So what did they do? They created a place where they actually examined the patients in the car. You drive up to the carport, you examine the patients in the car. You determine whether or not they need to be, sent to the emergency room, or whether they can be managed to, in less aggressive environments. But I mean, it's this kind of creativity, right? It's like, why do we have to have them come to the clinic? We don't need to do that. They also reduced the time from a patient that came to the clinic, went from the registration process, the wait time, all that kind of stuff, down to less than 2 minutes. So it was really just in time examinations for folks that did need to see the clinic. So there's just dozens of these examples in great organizations. I love the ones that Skip mentioned. I mean, that's what's so terrific about the method, is that, when you really are principle based, then you focus on the people that work for you, and you make sure they're safe, and you make sure that they're taken care of, whether it's economically, no layoffs, those sorts of things. And the places that don't have those principles are just the opposite.
So, Greg, to kick it over to you, a couple of thought starters. For one, KaiNexus works with a lot of customers, and KaiNexus as a company has also faced the challenge of adapting to pandemic times. So, as CEO of KaiNexus, what thoughts come to mind about successfully dealing with the pandemic?
So, there's three areas I'll briefly touch on. One, what we did at KaiNexus. So, for one, I think I probably mentioned to you in the past, Mark, that when the NBA canceled season, that was when the reality kind of hit me that we were dealing with something different than we had ever dealt with before. And when I was going to say passion, but really it's an obsession with learning about the pandemic and all things related to it started. We immediately went remote. It was a very easy decision for us. We felt like KaiNexus as a company was not going to be a remote company. We always felt that there was a need to go in the office, but the sacrifice of coming in the office didn't make any sense at that point. We also made a commitment to everybody that, and I'll never forget when Jeff, our CRO, described it to everybody. His visual was a little perplexing, but he said, "We're not throwing anyone off the boat. We're all going to cut our left arm off before anyone gets thrown off the boat." And so he basically just explained, we're all taking pay cuts. No one's going to get fired. And so I think that transparency, we've been extremely transparent with all of our numbers, being a startup with everybody, so they know that their job is secure. And so there were things like that. The things that really warm my heart a ton as well are just seeing our customers, especially healthcare customers, utilizing KaiNexus to help with pandemic efforts. There's improvements in projects that are going in that we're helping to facilitate. But the one that comes to mind was Mike McGowan showing us from Marietta Memorial, showing us his COVID response board, where they were virtually huddling around a board that gave all the pertinent metrics and information related to the COVID response going in at that hospital. So that was a lot of fun to kind of see how we're influencing. What's interesting is that even outside of healthcare, we had very few organizations that weren't doing something related to the pandemic with regard to their improvement work. And it was very clear that people that had the best improvement cultures responded to this the best, because at the foundation of lean is adaptability. I'll just visualize this, give you a 30-second visualization. If a company just stops in their innovation and in their adaptability, they die, right? And whether it takes them 5 years or 10 years or 20 years, they're going to die because the world is changing, right? So you can think about they have these statistics that the Fortune 500 companies in 20 years, like 80% of them flip over. And so the companies that do well in general are able to adapt to the situation. Now, companies that in their DNA have built in adaptability, have built in how do we create value to a customer, are going to be able to do that much quicker. So it's essentially what we had was in the last 7 months, we had 30 years business change that got compressed into 6 months, 7 months. And so you can imagine that the organizations that had been practicing that well are going to be able to do that at a hyper rate. And then I want to talk about one thing, because the story that Skip mentioned about the physician that noticed that the swabs were done incorrectly is I was just reminded of Daniel Pink's book Drive. I love talking to people about non-lean books that are important in lean. Hopefully we have an opportunity to talk about habits and building habits at one point. But Daniel Pink's book Drive, I think, is if you are a improvement leader or an improvement-minded person just in general, this is a really important book. And he builds up the concept that intrinsic motivation is founded with autonomy, mastery, and purpose. And in that story, it was very clear that she had autonomy, mastery, and purpose. She knew how the swab should be done, and she was obviously felt autonomous. She just kind of ran it by saying, "Hey, this is what I'm gonna do," and then of course, purpose is to do their job well as physicians. And so, having a deep understanding of intrinsic motivation is critical in continuous improvement and improvement work in general, because you cannot develop a culture of continuous improvement if you think that you're going to do this with external motivation tactics. There are times when external motivation tactics are important. Improvement work is not one of those times. And so if you haven't read it, should be your next book. Yeah. I have no financial connection.
Yeah, Daniel Pink, Drive. So normally we do announcements about future webinars at the end, but when we do a panel, we do those in the middle. So we're going to take just a brief intermission, make a couple of announcements about upcoming webinars and other events. And again, I was remiss in mentioning our friends at Lean Frontiers, who were partners in putting together and promoting today's webinar. So you can check them out at leanfrontiers.com. Our upcoming webinars, if you are a KaiNexus customer, our next training team office hours is going to be on October 1st. I don't know why that says October. I'm not really a beer drinker. I wasn't looking ahead to Oktoberfest, but defect-ridden work on my part. Sorry. But that will be with Adam Darnell and Matt Banna for KaiNexus customers only. Open to everybody, like today's webinar and our series. This is going to be presented by Scott Bergmeyer he's Executive Director of IQC. He's going to be giving a presentation about 6 key steps to create a culture of improvement. So you can register for any of those right now at kainexus.com/webinars. Today's session is being recorded, and it will be available in our webinar on-demand library with 7 or 8 years of recorded webinar content. We invite you to check that out. You can also visit our blog at blog.kainexus.com. And the audio of today's panel, if you want to revisit anything, or if you joined late or you want to share with others, will also be available through our podcast, which you can find basically anywhere that you find or listen to podcasts. So, and a reminder for people, you can, we're going to focus in a minute on audience questions, and you can submit questions or upvote other questions. But John, I want to come to a topic that we've talked a little bit about during the pandemic. A couple of times the Wall Street Journal has written articles blaming lean for shortages of paper towels or shortages of PPE. And they seem to make the mistake of equating lean with low inventory as opposed to equating lean with adaptability. There was an article I saw recently where Akio Toyoda, the CEO of Toyota, was saying really the key thing that they do is reducing lead times, which leads to adaptability in a different way that low inventory could not. So John, what are your thoughts on all this? I know that most recent article caught your attention.
Yeah, I think that most of these reporters are sort of missing they don't have the understanding of how lean thinking actually helps leaders and people get through these sorts of crises. So they tend to blame, just in time and all this kind of stuff as the reason that we are in such deep trouble. And of course, it's just not true. I mean, the examples that we've already heard, from my experience, Skip's experience, Greg's experience, are that when you have a effective management system based on principles, you actually can make decisions very quickly because you're relying on the brains of the people that do the work to fix the problems. We're never going to fix none of us could have fixed the supply chain issue related to the fact that almost all of the PPE was being produced in another world, another country. We weren't going to fix that. Okay, now, is it a problem that needs to be addressed? Yes, it is. But what we could do, like I said, what Torrance Memorial did was we got creative and we made our own PPE and we figured out how to, Duke Health figured out how to use hydrogen peroxide cleaning for their face masks so they, could reuse them, right? So, I mean, these are the ideas that come out of organizations that rely on their people to solve problems. And there's always going to be somebody shooting, at lean thinking. There always has been, there always will be. But the reality is that what happened and what's happening is that organizations that do have lean management systems have fared much better than ones that don't. And are there some structural issues that we need to deal with? I mean, the fact that, PPE was manufactured in, across the ocean somewhere, that's not lean thinking.
That's not shortening lead times.
Yeah, I mean, it's not lean thinking to do that. And when you look at companies that actually use lean thinking, they have a completely different way to manage supply chain, and they certainly don't have just one, vendor that's doing it. So the problems that have been, focused on in these articles really have, ironically, are just the opposite of lean thinking problems. Mm-hmm. And so I think that's the thing is that, we just need to continue to educate. We need to continue to explain, when we're looking at extended value stream, what does that really mean? And frankly, organizations that look at the world that way have fared a heck of a lot better than ones that, just wait for the CFO to get a unit cost down.
Right. Thank you for that, John. I hope the journal publishes your letter that you sent them, part of your education efforts to them. Thank you for that. We have a question here from Michelle, and maybe Skip will point this at you first because you talked about TWI and other standard work approaches. What are recommendations or what are things that leaders can do to hold people accountable for performing to the documented standard work?
I think the first thing we have to do is make sure we understand that word accountability and that we don't weaponize it and use it as a way to show disrespect to people. So, if we're going to talk about accountability, many times I'll ask folks, okay, fine, what are we going to hold someone accountable to? So if there is no standard for the outcome that I want on a process, and there is no standard for the method to produce that outcome, what am I going to hold them accountable to? And I say it that way because you find that more often than not. You find that there is no standard for the outcome. So when there is no standard for the outcome, whatever they're doing is probably good enough in their mind. And by default, whatever process they're using is probably good enough. If there is a standard for the outcome that they want, but there isn't a standard for the method to produce that outcome, then we're asking our people to guess. Or as Mr. Kato in Japan told me a year ago, you've chosen to neglect your people, which I thought was harsh, but I thought he made a good point. So I think that now, if we say, no, we want that, then if we're working with the real people that do the real work and they're participating in the standard, in creating the standard outcome and the standard method to produce that outcome, then the accountability doesn't become that difficult, except to build on what Dr. Jacobson said earlier. You might have to think about the habits and the routines that you want to follow up, to condition that behavior. Because I think if you do develop that standard and then you never follow up with it to confirm if people are following it or if they're struggling it because they can't follow it or whatever, that, then I think that shows disrespect too. And I think we've all seen that. So I guess to answer the question, Mark, is I would first start with, when we talk about accountability, what are we talking about? Accountability to what? Mm-hmm. Is maybe where I would first frame that.
Yeah, I mean, that's a great point. If there's not clearly defined or understood standard work, how do you evaluate against that? And I remember one of my mentors teaching me, to look into, like, is it that somebody won't follow the standard work or can't follow the standard work for some reason, and that becomes a system issue if they can't follow it the way it's documented, right?
Well, and just if I can make one more comment on that, that's where TWI job relations comes into also. How do I lead the person to follow it, assuming that everything's in place? JR job relations teaches that leaders have followers. You could be a boss and have hundreds of people reporting to you. That doesn't mean they're following you. And so job relations says, okay, I've got a standard here. I've got some job instructions to create a new behavior, but how do I motivate the person to follow it? And how do I lead them to follow it? And how do I get them to participate since they know more about the work than I do, because they're the ones doing it 10, 12 hours a day?
John or Greg, any thoughts on that question about, leading, managing, coaching to standards?
I think Skip said it really well. I like the word responsibility to each other a lot better than accountability, because if we have a responsibility to each other and we've defined what that standard is, whether it's outcome or process, then we can hold each other accountable. And but it's really a responsibility to each other that we are going to do work in a certain way. And until you define what that work is, to Skip's point, it's the wild, wild west. It's chaos.
Yeah. And it was a related question or comment from Edward. Skip, I think you touched on it a little bit. If you could talk about the common confusion between work standards and standard work. It's not just a flip of the words, right?
Well, that's a great question. I got a dissertation a year ago in Japan, and I'm still trying to get my mind unwrapped from that. Work, standardized work, to use that term, how Mr. Kato said that Toyota looks at it, is it's the full package. And meaning that I have a standard outcome, I have a standard method, and in that standard method, I have the order and the rate, and we're going to start getting into words like takt time and things of that nature to produce that standard method. But one way to think about these, to use it simple, is what's my standard outcome that I want? So if I can give an example, if that's okay. I was working with a testing line where we radically improved how long it took a person to drive up to get a test. And I asked the executive what was the standard outcome that he wanted. He said, well, I want quality and I want people to efficiently go through. And he used very vague language. And so respectfully, I said, I'm not really sure I understand any of that. How fast do you want it? How quick do you want people registered? Let's be specific on the quality. So we spent some time and we started articulating exactly what did the outcome as the customer, what do we want? What exactly do we want? Whether those be a time, whether they be quality, whether they be whatever the metric may be. Once we had that, we then started saying, well, what standard method will produce that outcome. And at first he said, just do this, this, and this. And we did that, and it did not work. And so we had to experiment with creating the standard methods to produce that standard outcome. So work standards tend to be typically, the way I think about it is work standards typically are the methods to produce the standard outcome. Standardized work is the full package of from the process to the end product and all along.
Thanks, Skip. There's a related question, and maybe to Greg and then John as physicians, that Mustafa asked. There was some reference given to the similarity between evidence-based medicine and standard work of management. What are your thoughts on when there's not agreement on some of the evidence-based medicine standards? Why is that, or how do you resolve that?
They should just do whatever I think. Then if that's the case. Sorry, I guess that was not funny.
Whatever Greg thinks, or whatever they think individually. No.
Yeah, no. Whatever I think, they should just come to me. No. So certainly, I think there is So I'm going to take it from the standpoint of order sets, because I think that's where this question is coming down from. So I think that certainly there are established nuggets of knowledge that it's very clear what the answer is. I don't know. I'm just going to make one up. If you have a bacterial pneumonia, I think everyone agree you need an antibiotic. Now you get into more nuance to, which antibiotic is the right antibiotic. And so to me, I think that that order sets that don't allow flexibility and don't allow people to deviate from them oftentimes create animosity to them. And so in my experience, the ones that work really well are the ones that are reminding you of things that you may forget about on an average day. Like, for example, smoking cessation. I'm trying to go back to my internal medicine rotation days, but someone that gets admitted for pneumonia that smokes, needs to get smoking cessation. That's not front of mind for a lot of people. But if it's all of a sudden on an order set, it makes it really simple to make that decision, right? That's kind of designing things. And most of the order sets that I've seen will allow you to deviate from them, and you can just put whatever reason you want to. I don't like that antibiotic, or I think this paper is right, or this paper is wrong. And so in my mind, there needs to be that flexibility for people to interpret the science in the way that they want. I think if some things are really well established, there probably should be a little bit more of a barrier and a threshold to deviate from those. And I think one of the beauties of an EMR, and maybe John, you could talk a little bit about this, but once you have all the data and you have big data, you can start to see, oh, well, Greg deviates from this. What are the outcomes of his patients? And maybe he's right, or maybe he's wrong. And once you start having the ability to look at that, you have the ability to give that feedback. Perhaps it's the order set that needs to be changed, and perhaps it's Greg's practice that needs to be changed. But that's the kind of my thought process and my approach when I've seen really well done order sets done. John, do you want to?
I was going to just interject. Mustafa typed that he thought the joke was funny, Greg. So you're off the hook.
Oh, thank you. I appreciate
John, go ahead.
I think this is a bit of a sticky wicket. And the reason is that, if you look at evidence-based medicine, there's probably only 30% of what we do that's fully, solidly based in evidence. Yeah. So that means there's 70% that isn't. So the question is, what do we do with that? To Greg's point, is it just you versus me, my way versus your way? I think, and this is what, we did when I was CEO, is I think you need to take a stance. You need to create standard work, even if you don't have evidence, because you're not going to know whether something is working until you have standard work for it. And if you've got 5 physicians and they're all doing something different, then you've got chaos. So what we tried to do in our hospitalist program was a good example, was where we didn't have evidence, we actually built consensus among the physicians around the standard work that we were going to use for that particular problem. And then we could study it and improve it. And I think that clinicians then just they sort of go back to, well, I'm a doctor, I can do whatever the heck I want. That's not the right thing. What we should do is have the doctors come together to say, what is the most likely thing that will work here, knowing that we don't have the evidence, and then we should study that. Again, it's no different. PDSA, we've got to study and adjust. We study the clinical standard work that we've created, and if it's not working, then we adjust it. But to just, throw it up and say, you're a doctor, you went through all these years of school, go ahead and do what you want. I don't agree with that. I don't think that's the right thing to do, because that's fundamentally not what continuous improvement is. It's not about my way versus your way. It's about a way. And if we can establish a way, then we can start to study whether that way actually works or not. And I think with the electronic health record, we have a much simpler way to really know whether things are working. Much faster, it's much cleaner. So we can do these mini clinical studies, so to speak. A lot of the stuff that's come out of the pandemic has been based on observational data.
Right.
The whole anticoagulation thing came out of observational data. And it was these studies, that, okay, we're going to put these patients into this category and we're going to treat them with heparin and we're going to see how they do, because we didn't have any evidence. So I think it's really important to decide what way you're going to go when you don't have evidence.
Mm-hmm. Can you speak to the website you showed me in the preview?
Yeah. So the Epic Healthcare Research Network Epic has put together a website which is now pouring in tens of millions of patients' de-identified data. And what it is, it's observational data on clinical issues. And so what's coming out of that then are studies that we publish every week or so about, what are we learning, immediately, not waiting for 3 years for something to be published in the New England Journal, but here's observational data. And actually the anticoagulation activity came out of that observational database back in middle of March. Lee Memorial or Lee Health System in Fort Myers was one of the first ones to identify that. So you can go to the Epic Research Network website, and if you have data that you want to put in there, there's tens of millions of patients' information now, COVID patients' information in there, and it's fascinating what's coming out of this observational database. And until we have placebo-controlled double-blind studies, that's all we've got. But at least it's a way, right? So this research is pointing us to a way. And that's the way we should be thinking about these emerging concepts on clinical treatment.
And I think utilizing the electronic medical record, while it's not blinded and not placebo controlled, if it's done well, you really can look at Group A versus Group B on areas of differentiation and then be able to study that. So I think you probably, from your level of experience of being a CEO of a hospital, have been in those kind of heated discussion rooms developing consensus. Me being on the front line side of it, where I'm kind of getting these, I welcome them because they do remind me of a whole bunch of things that I wasn't thinking about on my patient. And I've never been one to be too dogmatic about much in general. So getting, the ID doc's recommendation on what to do here, or the pulmonology doc's recommendation on what to do there, to me, I feel like it makes me a better physician. Mm-hmm. But to really take advantage of the EMR, and I'm blanking on, there was an anesthesiologist I met that is doing this. He's doing a startup. His last name was Lowe. I apologize, I can't remember the company's name, but they were really just
Daniel Lowe.
Dan Lowe, yeah.
Dan Lowe.
Thank you. Yeah. and they were kind of connecting into the EMR and able to run charts and compare, how did this anesthesiologist compare to that anesthesiologist? And that's next level. And if you can show to, I think they showed me an example of, hey, this ENT gets people out of the post-op in 5 hours, and this one gets it out in 10 hours. And what is this one doing different than that one? Just 99 out of 100 doctors are going to go, oh, I want to do some of that. That 5 hours is way better than 10 hours. I mean, we're all highly competitive and, want to be first in everything. So kind of, we've always been in the dark until now we have an EMR that if it's well designed and well easily accessible, we can start answering some pretty amazing questions.
Yeah. Dan is at Seattle Children's, by the way.
Yeah.
Thank you. Yeah.
All right. So maybe we have time for one more question. It's a meaty topic, but maybe we kind of go round robin a minute each. Faisal asks, when he hears the panel, it makes me wonder if continuous improvement in lean equals daily discipline equals culture. What are your thoughts or reactions to that? Greg's nodding his head and his laptop shaking.
Yeah, I mean, I'll just go first because I think you just hit it spot on. I mean, everyone says, "Oh, well, we want a culture of continuous improvement, and we want to have a culture of lean." Well, that means nothing other than it's just a collection of a bunch of people's behaviors. And if you get a whole bunch of people's behaviors to be aligned, that is what a culture is. I mean, Seth Godin says it best, and people like us do things like this, and that is his definition of culture, and that's exactly what this is. And then the only way to do repetitive behavior, which is you can't practice lean on Monday and then forget about it, is to create habits. And so it'll allow me to plug two books that I think profoundly changed my view on habits. One, The Power of Habits by Duhigg, and two, Atomic Habits by Clear. You really start understanding how do you develop cues, routines, and get the benefit of it? How do you change your behaviors? Just maybe those should be your next two books, but those should definitely be your next three books. So to me, that's completely spot on. And Mark, I want 30 seconds at one point to talk about letters to humans. So please permit me to do that after John and Skip.
We'll do that at the end. Thanks. Skip, real quick. Lean equals daily discipline equals culture.
Yes. So, I think that Dr. Jacobson said it right. I would plug a third book called Tiny Habits. That's very powerful. And I think we're all a product of our habits. The question is, are those the habits that we want? And so, if we walk into an organization, what kind of behaviors and habits do we see? What kinds do we want? And are there principles informing those behaviors and habits? And I think then you start to see the culture that we all strive for.
We wrote this book because it's all about habits. And that's what it's about. This is a social technical system, but without the habits, the social side, the technical side doesn't survive.
Yep. So that book is, of course, again, that's Becoming the Change. John and Kim Barnes from Catalysis wrote that. As we wrap up here, I want to thank everyone for attending. Greg, I will give you your 30 seconds. I want to thank Lean Frontiers for helping us out in organizing the panel today. Skip, I want to thank you for joining us, as always. It's good to talk to you. And Greg, thank you. And we'll go ahead and let you mention your information you have to share.
So I just want to point people to a side project that I've become very passionate about. Thank you, John. And I started writing letters to my friends and family at the very beginning of this and of the very beginning of the pandemic. And it has grown into something that I think a lot of people find very meaningful. And recently I put it all on a website called letterstohumans.com, where I attempt to scrub and they get the best data from the pandemic side of things, from the medical side of things, and write it to a non-medical, non-scientific audience. And they now come out once a week. And I know John mentioned it in our preview, the non-recorded portion of the preview. He was very appreciative and had been forwarding it. So please check it out. Letters, LETTERSTOHUMANS.com, and subscribe. I will never market to you. I only want your email address. I don't even want your first or last name, but I'm just trying to help people distill and synthesize the information that's coming out there.
All right. And speaking of, and thank you for that, Greg. And speaking of synthesizing information, a couple people asked, let's do a quick recap of the books that were mentioned today. So I've got Tiny Habits. I've got John's book. I've got Drive by Dan Pink. What else am I not remembering?
Atomic Habits.
Atomic Habits. Was it Atomic Habits, not Tiny Habits, or did both?
Well, there's Tiny Habits, there's Atomic Habits, and then there is, help me, Dr. Jacobson,
Power of Habit.
Power of Habits. Thank you.
I'm going to write a book called Nano Habits, maybe. Power of Habits, a great book. If anything else comes back to mind, shoot me an email, and I'll make sure that goes out in the email tomorrow with the link to the recording and other information. So with that, we're a couple minutes over, and I think we'll go ahead and wrap up. Greg, John, thank you.
John needs to final. I don't think John had an opportunity to say something. Oh, he's taking off. Okay, I thought that was what he was saying. Perfect.
So most webinars end not with a bang, but with a whimper. No, we'll kind of fade off here. But thank you, everybody, for attending and participating or watching, listening to the recording. We're getting a lot of thank yous. And again, to those who asked about the books, those will be in the follow-up email that you'll get tomorrow. Skip, why don't you mention real quick for the people who are still on, you have a great book. Remind us the title of that.
Yeah, it's called Creating an Effective Management System. Patrick Gropp from the TWI Institute, myself, and Brad Parsons, one of the CEOs of our Memphis hospital, wrote that about a year ago, just to kind of really just to work out our thoughts. So called Creating an Effective Management System.
And again, Greg's website, thank you, Skip, is leanforhumans.com. So hopefully we will see everyone in future webinars. You can register at kainexus.com/webinars. So thank you again. We'll see you Kai next time.
Thanks.
Thank you.
See you Kai next time. Thanks, everyone.